Thank you, sir.
Good morning, esteemed chairpersons and my dear friends. So my talk is on Intumescent cataract, that is eminent to Argentinian plaque sign, and how to manage it. And thank you, Terminator, for giving me the opportunity. Slides are not moving. So I have no financial interest in the subject matter. So this Argentinian flag sign is a self-propagating radial extension of the anterior capsular tear, and which typically arises instantly after an initial prick with a sharp hypodermic needle or a sharp tip rhexis forceps. So it was first described by the Perron. So it just looks like an Argentinian flag sign and is the most common complication for the intumescent white cataracts, as per this study. So the Perron described it to be the sequelae of a raised intralenticular pressure as the only factor responsible for the propagation of the initial prick into a radial capsular tear. But there are other factors also, from posterior to anterior compartment pressure, high pressure anterior compartment propelling the posterior compartment, and also the forward thrust of nucleus is also observed. So there are various techniques available to neutralize raised intralenticular pressure and decompress the bag, like two-stage capsular access, mini rhexis, phaco-capsulotomy, precision pulse capsulotomy, puncture-access, Brazilian technique, and also now flax is coming up. So there is this small needle aspiration technique. It involves pricking the anterior capsule with a sharp 26 gauge hypodermic needle. That is followed by the simultaneous aspiration of liquefied lens matter to decompress the bag, and quite often peripheral extension of the capsular tear commences instantly after pricking the anterior capsule, even before the liquefied cortex aspiration is initiated. So there are many mechanics of the Argentinian flag sign, and so it means there had to be some other factors responsible which assist the raised intralenticular pressure to propagate the splitting of anterior capsular tear, resulting into the Argentinian flag sign. So this is a beautiful, wonderful study under the leadership of Rajendra Prasad sir, and it was published in JCRS. You can go through the whole article. It's freely available. So what is not known regarding the Argentinian flag sign? In reality, it's not the raised intralenticular pressure the only factor responsible for the extension of tear. It is the configuration of the initial puncture created to open up the anterior capsule by the sharp tip hypodermic needle or the rhexis forceps. So when we are puncturing the anterior capsule with an ultra sharp beveled hypodermic needle or sharp tip rhexis forceps, results into a small linear cut with open edges along the entry. So there is raised intralenticular pressure that triggers the disruptive forces along the discontinuous open edges of the linear cut. And so what is not known, that this linear cut easily opens up and it's rapidly radialized to the periphery, resulting into the Argentinian flag sign as seen in this animated video. And this tear always extends radially along the discontinuous open edges of the linear cut. It is never perpendicular to the tear. So we came up with the hypothesis that if we are able to manually create an opening in the anterior capsule which had a round and regular configuration instead of a linear cut, we may provide resistance against the disruptive forces, thus preventing Argentinian flag sign. So to open up the tense and stressed out anterior capsule, we designed and developed a novel instrument that is known as sieving needle microcapsulotome with a smooth round pointed tip similar to sieving machine needle system. So this round pointed tip, when puncture the anterior capsule, create an opening with a smooth and round configuration without any discontinuity. So these are the real-time videos. So there is a round hole microcapsulotomy with round regular configuration that provide greater resistance against the disruptive forces generated by the high intralenticular pressure, and It also allows the liquefied lens matter to egress, thereby decompressing the bag without propagating a radial extension of tear. So, after this round regular opening, the rhexis, the intended rhexis of 5.25 to 5.75 is easily achievable. And we also did a clinical trial when we compare this world's first such clinical trial between sieving needle microcapsulotomy versus the simple needle aspiration, and there was a significant p-value difference of 0.001. So it's a very effective technique and can be easily done by anyone. So for complete evacuation of fluid, multiple these punctures can also be created. So these 7 extension into the Argentinian flag sign using the simple needle aspiration, whereas only 1 extension was seen. And so in conclusion, in intumescent white cataract, it is primarily the linear cut configuration of the initial prick which has the potential to spontaneously extend along its open edges, leading to Argentinian flag sign. And the sieving needle microcapsulotomy with round regular configuration like a capsulotomy in true sense provides resistance against the disruptive forces that is triggered by the high intralengular pressure, and the initial decompression of the capsular bag facilitates safe and controlled creation of a capsular axis of an intended size with a higher level of efficiency and safety. Thank you so very much.